we did is, it was New Beginnings, which is a homeless youth program in Lewiston, and the Western Maine Community Action Health Services, specifically our Lewiston STD Clinic and our Outright Lewiston Auburn program. Those three organizations have been planning this event for a while, and what we wanted to do was raise awareness about HIV and AIDS in the community and raise some money specifically for prevention work, HIV prevention work with young people.
Hang on, let me do one with your face and focus. There we go.
There hasn't been an AIDS walk in Lewiston Auburn, and we're thinking at least 8 years, somewhere around there. There are walks in several cities around the state, and we really wanted to try to revive that. We feel like there's been a lag in community awareness and just attention to HIV and AIDS, and felt that the time was right for us to do the work of putting an event together that would raise awareness, raise some money, and try to get HIV and AIDS back in the public eye where we think it should be.
There's 1,200 people in the state that are currently living with HIV or AIDS, and we guess, and this number we don't really know, is we think there's about 400 people who are living with it and don't know. Thank you very, very much, and for the work you're doing, for being out here and bringing awareness and people's attention to it.
I think the thing that people should know is that HIV is still out there. We still don't have a cure. Prevention is reasonably easy, but it's hard for us sometimes to change behaviors that might put us at risk. So we need to continually be helping people understand that, helping people to remember that HIV is still out there. There are people with HIV or AIDS in every county in this state, and some folks know that they have it and they're very good about being careful that they're not spreading HIV. But there are plenty of folks who don't know because they may not have been tested, may not even realize that they're at risk, and that it is an issue. And AIDS crosses gender lines, it crosses class lines, it crosses the rural-urban divide. There isn't any community that isn't affected in some way. I think people my generation who were around at the beginning of the epidemic, we watched a lot of men our generation die, and a lot of women our generation die across this country. And I think for young people, that's fallen off the radar screen. They don't have that remembrance because people are living longer and they're taking medications. So it's shifted in how the impact is on in terms of the epidemic, but that doesn't mean the epidemic hasn't gone away.
Hung in the door of Randall Estate, home to a true heart.
You know, one of the things that has changed in the last couple of years, that in every annual physical that we have, there's an AIDS test, and that's a big thing, because there should not be a stigma.
I think there's still a big stigma around being at risk, and I think that's not just for HIV, but for any sexually transmitted infection. And there's still a perception that only certain people get it. Not the case. You know, it's about behavior, not population groups, and that's important for people to remember. We try to be out there as much as we can to let folks know we're available. We do HIV testing here in both of our clinics. We run two here, the Lewiston STD Clinic and the Family Planning Clinic. So it doesn't matter which door people come into us, for what service they're coming in, an HIV test can be a part of their care. And a lot of it's word of mouth. People really let people know that we're here. I think that's the biggest thing. And events like this, just really trying to get the word out.
Our faces are past in the night, onward to places where true hearts reside.
because there hadn't been a walk here in a long time, and we weren't sure what the community response would be. But I think it speaks to people are interested, people do want to hear about it, do want to know, and be a part of something. And I think it also speaks to what you can do when you get together with a couple of organizations, rather than any of us trying to do something alone. I think everything New Beginnings brought to this, everything that Western Maine Community Action brought to this, made it a success. We're thrilled.
What's that?